Throughout this year, we're going to be discussing more topics in the diabetes field. And for today's lesson, let's focus on a highly underdiagnosed and less common form known as type 3C diabetes. That's also referred to as pancreatogenic diabetes. And just like type 1 and type 2 diabetes, it's caused due to the impaired ability of the pancreas to produce enough insulin. However, unlike type 1 diabetes, this is not due to genetics, and unlike type 2 diabetes, this is not due to increased consumption of glucose, but rather this is due to a damaged pancreas. And that can have a few different causes, such as chronic pancreatitis, cystic fibrosis, pancreatic cancer, as well as the removal of one's pancreas. And individuals who are suffering from type 3C diabetes will have standard diabetes symptoms, but also additional digestive symptoms, such as bloating, fatty or oily stools, as well as abdominal pain. And additionally, just like type 1 and type 2 diabetes, treatments can involve providing insulin, as well as providing pancreatic enzyme replacement therapy, or PERT, due to the fact that that pancreas is not working as properly. So make sure to stay connected to my channel and with Dane Garvin as we continue covering a broad range of topics in this field. Thank you for watching my latest video. And if you're not already, make sure you're subscribed to the channel by clicking over here. And you may also enjoy a related video that I have, which you can find by clicking over here. I'll see you on the next one.